All right, everyone. I hope you can hear me well. I think we'll get started because we have quite a lot to get through, but I see people are filtering in. We have a very good number already. So delighted to have you all with us. You're very welcome to this webinar on the MHPSS Minimum Service Package Monitoring and Evaluation Indicator Bank, which we'll just call it the Indicator Bank for short. There's a lot of words in the title. But my name is Caoimhe Ward. I work with UNICEF at headquarters, and I'm here with my colleagues Vania Alves, who's also from UNICEF, and Inka Weissbecker from WHO. And together we're going to be introducing you to this tool. We're also very fortunate to have some special guest speakers that we'll introduce as we go along. And in the meantime, we'd like to invite you all to say hello in the chat box and just let us know who you are and maybe where you're working, so that we know who's together with us in this virtual space today. We also have a great team of interpreters who'll be translating into French, Spanish, and Arabic as we go along. So if you'd like to change the language, you can just go to the interpretation button at the bottom of your screen and select the audio channel that you would like to listen to. You'll also see a button for Q&A, questions and answers, at the bottom of your screen. This opens a separate box for asking questions, so please do add your questions in there as we go along. We'll do our best to answer some of them in writing, so that we don't have so many to get through at the end in discussion time. The Q&A box is separate from the regular chat box, so just try and put your questions in the question box, so that we can answer them in there. We'll also post the agenda in the chat box now, and we'll just dive right in because we have a lot to get through, like I said. So first of all, why is it important to monitor MHPSS programming? Well, there can be a perception that mental health and psychosocial well-being are a little bit hard to define or hard to measure, and so people can feel a little bit uncertain about how best to monitor the impact of these sorts of programs. Generally speaking, in the MHPSS community, we're a little bit better at measuring the number of people we reach with a service than measuring the extent to which our service has actually helped those people. MHPSS is also a very diverse field, so there are different views on what works and even what counts as evidence and evidence-based practice. And so for that reason, we see a wide range of MHPSS activities, some of which have been tested in randomized controlled trials, and others which are more based on expert experience, lived experience, and expert consensus. So for lots of reasons, the activities we see in practice in humanitarian settings are not always based on what you might consider gold standard evidence. So for that reason, it's really important to make sure we monitor the impact they're having. There's also sometimes a misleading perception that mental health and psychosocial support is kind of harmless, or it's just common sense and anyone can do it, so we don't need to worry too much about adverse outcomes. But of course, unfortunately, we see lots of examples of people trying to help where it can actually make people feel worse or increase distress. And maybe you've seen this in your own experiences. We've seen it with things like psychological debriefing, single session psychological debriefing, or critical incident stress debriefing, where we've had scientific reviews for many years that actually say there isn't evidence to show that this helps, and there's some evidence that it might actually be increasing rates of PTSD, but yet we still see it quite commonly in practice in emergencies. So the potential to cause harm in this field is actually very high, and we have an ethical obligation to investigate whether our interventions are actually helping or causing harm. The good news is it can be done, and we hope that this session will help to demystify that process a little bit by explaining how the Indicator Bank and other tools can help. So the Indicator Bank was developed to accompany the MHPSS Minimum Service Package, or MSP. So I'll briefly explain what that is first, for anyone who's not familiar. So the MSP is a set of high priority MHPSS activities that brings together expertise from 11 different sectors to meet the mental health and psychosocial support needs in an emergency. It draws on work in health, protection, education, wash, shelter, and so on. And the idea is that by having a common framework that outlines which activities are needed and who typically does what in an emergency, we'll have a faster, more effective, and better coordinated response. So the MSP includes both programmatic activities and non-programmatic activities. The non-programmatic activities are things like coordination, assessment, program design, monitoring and evaluation, ensuring that our staff have the competencies they need, and ensuring that staff are cared for. Then the programmatic activities cover everything from community-wide messaging on coping strategies to promoting traditional community-led peer support activities, building the skills and capacities of caregivers and teachers to support the mental health of children, right the way up to focused and specialized services like psychological interventions. So each of these activities comes with a checklist of actions to help implement it safely and a list of relevant resources. So we're not going to go into the activities in detail today just because we don't have time, but you can use this QR code to explore the activities on the website, and you can also find recorded webinars providing more information on there too. So we can add the link in the chat box for that as well. So since the minimum service package came out in December 2022, we've had a lot of requests for guidance on how to monitor and evaluate each of the MSP activities. And so this is why we developed the indicator bank. So implementing agencies were telling us they wanted help to identify specific indicators to measure the reach and the impact of each MSP activity. And at the same time, coordination groups wanted indicators to help monitor the MHPSS response as a whole at the interagency level to help feed into things like humanitarian response plans and refugee response plans. So the indicator bank was developed to address these two things, and it provides a menu of suggested indicators for each MSP activity, but also broader indicators to help interagency coordination groups to monitor the response as a whole, to help with interagency planning and reporting and so on. So it was developed by reviewing a wide range of existing frameworks and operational guidance and indicator libraries that were developed in different sectors and areas of work. You can see some of the sources on the slide there. And where possible, we used existing M&E indicators or adapted them slightly to work within the framework. We also then gathered feedback from different representatives coming from different sectors and areas of responsibility, as well as monitoring and evaluation experts. So let's dive in. I'm going to hand over to Vania now to show what this looks like for each MSP activity.
Thank you, Caoimhe. So moving on to the next slide, as was mentioned, the indicator bank contains suggested indicators to monitor the reach and the impact of each MSP activity. The indicators provided serve as a bank or as a menu of indicators to choose from. It is not a complete list of all possible relevant indicators. Rather, it is intended as a starting point for building or strengthening monitoring and evaluation of MSP activities. The total number of indicators you select will depend on a range of factors, such as the resources you have available for data collection and analysis, and any interagency agreements on common indicators. The indicator bank can be used as a starting point for deciding which indicators to choose according to the specific content and goals of a given activity. Data on age, gender, and disability status should be collected alongside indicator data where possible to allow for disaggregation in analysis and reporting. Now, the indicator bank suggests a range of indicators that may be used or adapted for different contexts. For each MSP activity, indicators are presented that measure both the reach what we call process indicators, and the impact of that activity. Now, process indicators measure the number of participants or events associated with the activity. Examples include the number of people trained, the number of people engaged in psychological interventions, or the number of people contacted through an information campaign. They tell us how many people participated, but they do not tell us whether the activity had any positive or negative impact on those people. Now, impact refers to an increase or decrease in participants' knowledge, skills, attitudes, mental health, and psychosocial well-being over the course of an activity. Examples include changes in knowledge, attitudes, changes in levels of functioning, subjective well-being, severity of distress, frequency of symptoms, in coping ability, in social behavior, or in social connectedness. Now, it is important to measure changes, both positive and negative, to be able to understand the impact of the program, for example, an improvement or a worsening of symptoms. However, data on change must be interpreted carefully. A wide range of factors shape mental health and psychosocial well-being, so changes detected are not always the result of the activity alone. For example, if a community experiences a new outbreak of violence while an MHPSS activity is ongoing, pre and post tests may indicate a worsening in mental health and psychosocial well-being that is not attributable to the intervention. Now, this is what it looks like in the indicator bank. This is activity 3.7, promote caregivers' mental health and psychosocial well-being and strengthen their capacity to support children. As you can see here, we have a range of process and impact indicators that may be used or adapted for different contexts. The suggested process indicators focused on the activity implementation, on its reach. Here we have the number of service providers trained to provide MHPSS orientations, capacity building, and supportive follow-up to caregivers. The number of service providers supervised while providing MHPSS to caregivers, and the number of caregivers reached through orientations, capacity building initiatives, and supportive follow-up. Regarding the impact indicators, we have the percentage of caregivers that demonstrate or report an improvement in their mental health and psychosocial well-being associated with the support received. The percentage of service providers trained that demonstrate or report improved knowledge or skills for providing MHPSS orientations, capacity building, or supportive follow-up to caregivers, and the percentage of caregivers that demonstrate or report increased knowledge or skills in responding to the mental health, the psychosocial, and development needs of children. Now, for those of you familiar with the MSP, you'll know it doesn't only contain programmatic activities. It also contains activities on program design, on developing a monitoring and evaluation system, on supporting staff care and staff competencies. So the indicator bank also has suggested indicators to monitor these activities. These kind of indicators are relevant to you, no matter which specific program activities you are implementing. So for example, here under activity 2.1 on program design, there are process indicators like ensuring a crisis management procedure is in place, and also impact indicators like percentage of participants who report satisfaction with the activities they participated in. You'll also see that there are suggestions for qualitative analysis, like exploring the extent to which participants feel each program activity is effective and appropriate to their needs, and identifying areas for improvement. We won't go into the other activities in detail that you are now seeing on the right side of the slide, But as you can see there are similar indicators available for all the activities. Now, how do we measure impact? By looking at domains of well-being, like functioning, subjective well-being, levels of distress and symptoms of mental, neurological, and substance use disorders, levels of coping, social behavior, social connectedness. These domains come from the IASC Common Monitoring and Evaluation Framework. So the indicator bank is aligned with this. As you can see in the table here, the indicator bank suggests which domains may be most directly impacted by each MSP activity. For example, depending on your specific curriculum, activity 3.6, which is group activities for children, is likely to impact things like subjective well-being, coping, social behavior, and social connectedness. Whereas activity 3.10, mental health and general health services, may impact functioning, subjective well-being, distress, mental, neurological, and substance use disorders, and coping. Again, this links back to the IASC Common M&E framework, where you can find particular tools like validated questionnaires that can be used to measure each of these things. Those tools are known as means of verification. So this is what it looks like in the IASC Common Monitoring and Evaluation Framework. You have tables with quantitative tools or means of verification. They are organized by domains of well-being, as you can see on the top row, and also age groups. So for example, if you're looking to measure levels of daily functioning in a group of young adults aged 18 to 25, these are some of the tools that you can use. And these are some of the qualitative approaches. Thank you, Caoimhe. These are some of the qualitative approaches for measuring levels of daily functioning in that same age group. And finally, you can also find the tools on the Means of Verification Toolkit on MHPSS.net. I will now hand it back to Caoimhe that will walk you through a case scenario.
Great, thanks so much, Vania. So now we're going to walk through a fictional scenario that demonstrates how someone from an implementing agency like an NGO or a government service, how they could use the indicator bank to help them write a proposal, to design the activities, monitor, and then report on the data from that program. So I'm going to introduce Amina, and she's an MHPSS officer at a camp for internally displaced people. And a recent needs assessment in the camp found that adolescents are experiencing high levels of loneliness and low mood. And so Amina decides to write a proposal for funding to deliver a program of structured group activities aiming to improve subjective well-being and social connectedness, hoping that these activities will address this low mood and loneliness that she's seeing among adolescents. So Amina wants to make sure she designs a high-quality, evidence-based program. And she wants to make sure she collects data on the number of adolescents reached, but also the impact of the program on how they're feeling, on their mental health and psychosocial well-being. So how can she use the MSP and the indicator bank to help her? Well, first, she checks the list of MSP activities and she finds activity 3.6, which we know is provide group activities for children's mental health and psychosocial well-being. So then she goes to the MSP website and dives into this activity, 3.6. And here on the website, she's able to find an introduction explaining why this activity is important. That will help her with the narrative part of her proposal. She also finds a checklist of actions that need to happen to help implement the activity safely. That will help her design the actual program. And she also finds a list of relevant guidelines, standards, and tools. So you can see here we've got a list of general guidelines on MHPSS and child protection, some training materials that she might want to use, and also a list of structured group activity curricula and other relevant program materials. So she has a look through these curricula and she wants to find one that's suitable for adolescents and that impacts on subjective well-being and social connectedness, the two domains of well-being that she's interested in improving. So she does a bit of research and looks around and finds the one that sounds most relevant to what she's looking for. So for example, she might select this one called Team Up, and she decides that's what she's going to go with for her program. So next she wants to identify monitoring and evaluation indicators to measure the reach and impact of the program. So she goes to the indicator bank. And of course, she knows it's activity 3.6 in the MSP. So she goes to that section of the indicator bank. And she also knows that there's space in the proposal template just for 2 indicators. So she reads through and she selects one process indicator, the number of children that participated in structured group activities. And she selects an impact indicator, the number of children that report or demonstrate an improvement in their mental health and psychosocial well-being following their participation in the structured group activities. So she adds these indicators to her proposal. Now she knows that the aspects of mental health and psychosocial well-being that she's aiming to improve are subjective well-being and social connectedness. But she also knows that the facilitators in the camp don't have a lot of time or capacity to implement long structured questionnaires, long pre and post test tools for measuring different things. So she decides to just focus on one impact domain that is subjective well-being. So she wants to find validated data collection tools or means of verification to help her do this. And so her next step is to go to the IASC Common M&E framework, and she looks up table 1 on page 13, which we saw earlier. And here we have this really handy summary of recommended tools for measuring these different domains and different age groups. And so here she sees that, okay, for the age group 12 to 17, to measure subjective well-being, there are 3 recommended tools to consider. So then she just looks up these tools and does a bit of research to see which would be most suitable for her context. And she takes into consideration things like how long is the tool, how long would it take a child to complete it, how complicated is it to analyze it, and also the items in the tool, are they relevant to this context? So based on that, she decides that in this case, she'll go with the Sterling Children's Wellbeing Scale. She thinks it offers a good balance of number of items without taking too long to administer. So now we're going to fast forward a few months and I'm happy to report that Amina's proposal was accepted. The programme was rolled out according to the core actions in the MSP and the curriculum that she found in the MSP. They were able to collect data on subjective well-being using the scale that she found in the Common M&E framework. And we can see from this graph here that the mean pre-test score was 25, the post-test score was 55, so we see a substantial improvement in adolescents' subjective well-being. So of course, our fictional donors are delighted with this and they decide to fund the programme for another year. So that was a completely made up story, but we just wanted to walk you through how an implementing agency could use the indicator bank to help them propose, design, implement and monitor a programme from start to finish. Next, we're going to move away from individual implementing agencies to look at how the indicator bank can help at the interagency level to help coordination groups monitor the response as a whole. So I'll hand over to Inka for this section.
Great. Thank you, Caoimhe. So this indicator bank also suggests indicator for monitoring the MHPSS response as a whole, meaning monitoring MHPSS at the agency level. So this is something MHPSS technical working groups in different clusters or areas of responsibility usually need to do to help monitor progress towards targets in, for example, humanitarian response plans or refugee response plans. So the MSP indicator bank suggests indicators for monitoring which MSP activities are being implemented across the response as a whole, indicators on overall numbers of people reached, orientations conducted, referrals, and so on, as well as data on how well the MHPSS coordination mechanism is functioning. So this diagram you see on the slide is an illustration on how information might flow between the different interagency coordination mechanisms and how MHPSS may need to work with different sectors, clusters, and AORs for reporting of these general indicators. And the indicators, as you see there, it's maybe a bit small. So also take a look at the actual document. The indicators are organized by theme. For example, overall MHPSS MSP indicators, also indicators on coordination, on assessment, on MHPSS orientation, training and supervision, and so on. And the table actually goes on to include things like reach of MHPSS services and activities, referral and impact. So on the next slide, you see that sectors, clusters, AORs, and other coordination groups may also select indicators to monitor MHPSS activities within their specific areas of work. So there you see an example from health, where we have, for example, number of persons who receive clinical management of mental, neurological, and substance use conditions through medical services like primary, secondary, tertiary healthcare. This is actually also an indicator in Sphere, I think. And we have an impact indicator there, number and percentage of people who have received care for mental health conditions who report improved functioning and reduced symptoms. So these are some of the indicators that the health sector or health cluster may be especially interested in. You have this then for many other sectors, clusters, or AORs, as you see there on the slide. And so now we're going to hear about a real life example of how the South Sudan MHPSS Technical Working Group used the indicator bank. So we're very happy to have Zena, Awad, and Felix Ojok from the South Sudan MHPSS Technical Working Group to tell us about their experience. Over to you, Zena.
Thank you so much, Inka, and thank you so much for everyone to give us your time and attention for us to be able to share the example or the experience of South Sudan. As mentioned, this is very much about tracking or trying to measure the response as a whole in South Sudan, and this is interagency work that we will be looking at that was conducted during my deployment, the 6 months from July to December 2024. And we wanted to sort of give a bit of reflection first on the approach that we had, which was very much process-oriented. It entailed a set of workshops. The first series of workshops were supported by UNHCR. We were really lucky and fortunate to have Leticia visiting South Sudan, and we were able to conduct workshops targeting the technical working group, the health cluster, the protection cluster, the education cluster. We were able to do learning sessions and conduct different types of discussions, if you like, with different groups, partners, and clusters. And then the last part of this process, the last phase of it, was very much initiated through the health cluster with the budget that we have. That we had to do an intercluster planning workshop because that was combined with the 2025 activity planning that all partners who were active in technical working group were already preparing for. So what we did was this is 3A, we had a technical working group 2025 activity planning workshop using the minimum service package where the indicator bank was introduced. And then this was followed up by a validation workshop where we looked at a developed toolkit that we call indicator matrix. We can also refer to that as indicator tracking table, if you like, which is meant to help the colleagues and the partners throughout the year to actually track progress and to measure some results. We can go to the next slide. Why is this important? We felt that it was important to also reflect a little bit on the benefits of such an approach, because first of all, it sort of built ownership and it enhanced the harmonization of the minimum service package being implemented through coordination and the engagement of partners. It was also very much about standardization through collaboration cross-sectorally and to roll out the MSP in a way where we can also have indicators to measure each activity, each MSP activity for the response as a whole. And it meant also that we worked together to integrate the indicator bank into this tracking tool, and it meant as a result that there was a sort of ownership, collective ownership of the indicators that we're supposed to be using in 2025. And in a way that is working towards or contributing towards addressing the gaps that have been identified already in South Sudan. We also were working on the strategic plan, so the MHPSS strategic plan for South Sudan, and the gap of data, MHPSS data, was an identified need that needed to be addressed. So in a way, using the indicator bank and developing a tracking tool to look at the response as a whole was going to be, a stepping stone in a direction of actually start collecting, collaborating and collecting data to understand and be able to advocate for the needs for more funding, to be able to do advocacy for funding and target donors. Also for informed decision making, because nobody is supposed to be implementing the whole MSP on their own. So having indicators will also allow us to measure what's being done, how much progress, and how can other types of actors bring together their resources to fill those gaps. And finally, it was really important for ensuring sustainability, because if we don't have the capacity to collect data, the data will not be collected. It's simple as that. And through collaboration across sectors and clusters and partners, we were able to have one toolkit that can be used cross-sectorally within clusters, but also across different sectors. So we can move to the next slide. Thank you. So this is the big matrix. I just took a snapshot of it, so it's not the full matrix. It sort of fit only the first two components, section 1 and 2. And as discussed already, the first component, so the first section 1 of the MSP, we included that followed by the second column on the left, the expected outcome. So for example, interagency coordination and assessment, the expected outcome is, of course, to have a humanitarian MHPSS response that is well coordinated and is actually sensitive or responsive to the needs and the context and the gaps. And then following on from that, the third column is very much about the activity under the section. So there are different activities, 1.1, 1.2, and the core actions. So the sub-activities, if you like, for each activity under each section. And what was done in the workshop that you see mentioned at the column to the right, where it says actors, that was on the 2nd of December. It was actually the planning workshop that we had, where you see the names of the different agencies. It was actually each agency represented by one participant. It was 48 people participating in that intercluster workshop. And what we ended up doing was that we set in groups. We printed out this matrix in an A3 sheet. So it was sort of, maximized to the point where we can actually see what was written in it. And the different agencies put their names down as per the planning for 2025. Now, of course, everything depends on funding. So this is just the ambition and the planning and the sort of fundraising that was being worked on in December, beginning of December 2025 in South Sudan. This was followed by the validation workshop. We called it validation workshop because most of the work was done already. And the validation workshop, we started off by reintroducing the indicator bank. So we had like half a day of a training, if you like, on the indicator bank, and focusing mainly on the response as a whole. So focusing on what Inka was just presenting, to look at what can be done within sectors, but also across sectors. And we inserted into this matrix the indicators, the general indicators, process indicators, and impact indicators. As you can see, for section 1 related to coordination and assessment, we don't really need to measure. There are no impact indicators, but there are the general ones. For example, do we have a multi-sectoral technical working group? The number of clusters and AORs, etc., represented. The process indicators, how many members and agencies are, attending, engage, how many times the group is meeting, once a month, etc. The second section, of course, is more going into the the sort of essential components where all agencies are expected and hope to be doing, such as monitoring, evaluation, supporting their own staff, capacity building, etc. And here there are very much process indicators related or that are applicable, as well as, of course, the impact indicators. So number of participants in different trainings, for example, and the impact, the increased knowledge, skills, etc. So this was the foundation work for actually now using the indicator bank. And I'm going to move on to the next slide. This is the final slide before bringing in my colleague Felix, the co-chair, who will be telling us more about the exciting work ahead of us. So this was an indicator matrix that, we did not reinvent the wheel. This was just bringing together the minimum service package, activities, and then putting the indicators next to them. So it's actually just hoping to make the work a bit easier on collecting data. And it goes without saying, it's the MSP section, the expected outcome, the MSP activity, and of course, the indicators that are applicable to each of those activities. And as you can see, the first section is the reporting agency is a technical working group, which is why, there's no reporting agency to be entered into this part. But then when we move further to the following sections, again, this is a screenshot. I was only able to fit in section 1 and 2. Section 2, you can see that we are expecting the reporting agency it's a scroll down, so you can click and actually click on your agency, because these agencies are already committed, if you like, to report on these indicators. And of course, the cluster, because some agencies, such as UNHCR, for example, work in multiple sectors and different clusters, the health cluster, as well as the protection cluster, etc. And then the quarterly, so the last 4 columns is the ambition. And I'm eager to hear from Felix how that's going. The ambition is that the agencies are expected to respond on this survey or this, fill in this questionnaire on a quarterly basis. So it's timely now, towards the end of March, to start preparing agencies to report on a quarterly basis on their indicators. We hope that this will facilitate the work. This has never been done before, so it's a bit of a test. It's a pilot, and South Sudan are very, very courageous and brave to take this on. All the 48 partners who are in the technical working group were very eager to start this reporting process. And let's hear from Felix. Thank you so much. Felix, over to you.
Well, thank you so much, Zena. I would like to handle probably 2 main areas with our listeners who are here. Well, and the first area that I want to tackle a bit is look at how useful the MSP workshop that Lecture did to us in South Sudan. Okay, so this workshop really, really, really contributed a lot. If I may recall, sorry. If I may recall, by the time when Zena was deployed in South Sudan and then Letitia also came in, I want to plug in a little bit that before that, prior to that, 2021, Watch Child Olan, HealthNet, TPO, UNICEF, and World Health Organization piloted MSP in South Sudan. And the 2 organizations took series of different activities. And then from that lesson learned, by the time Zena was deployed, and then the workshop that Lecture came to conduct was a very good heads up. And how did this benefit the different actors in South Sudan? In the first place, it was very engaging. So many partners had the opportunity to come together with various stakeholders, including government agencies, national organizations, community organizations, fostering collaboration and shared understanding of mental health and psychosocial support priorities, which has been so beneficial. This is something that many people had in mind, that when they talk about MHPSS, especially MSP, it's more of clinical intervention majorly. But then through this MSP, people got to understand even much more deeper aspect of the community interventions. The other second area of concern has been harmonizing efforts. By providing these standardized guidelines and best practices, the workshop have helped to harmonize the efforts of different sectors such as health, education, protection, nutrition, and this has ensured a more coordinated and effective response to the mental health and psychosocial support needs. Okay, and maybe I would conclude by saying the capacity building part of it. This workshop also focused on building the capacity of local partners, especially in what? Enhancing their ability to implement mental health and psychosocial support activities effectively. So overall, this workshop have been very instrumental in creating a more cohesive and integrated approach to mental health and psychosocial support in South Sudan, benefiting both service providers and communities that the different agencies serve. That is one thing, and I would say bravo to Letitia and Zena, and together with the Interagency Standing Committee overall. And then the second area that I would like to summarize with is look at how useful the indicator bank is and how the technical working group intend to use the developed indicator metrics to collect mental health and psychosocial support data, which has been identified as a gap in the national MHPSS strategic plan that South Sudan has for 2025 to 2028. Okay, and the first one is on standardization. This indicator bank provides a standardized set of indicators that can be used across MHPSS activities, ensuring consistency in data collection and reporting. If you've heard from Zena's presentation, South Sudan, at the end of this March, we actually trying to look at how best we can start filling in our indicator bank. So we can have this, like she said, this is the first of its kind. It may be a little unique. It may be a bit tiresome, but then we are taking, as the technical working group, we are taking the different partners and encouraging them that we have to use this. And if this has been done, the entire world would see the outcome of this. The second benefit is on comprehensive monitoring. The indicator bank help in monitoring both the reach and impact of MHPSS activities, which is crucial for evaluating the effectiveness of interventions. Okay, this is one thing, and when we reflect back in what War Child has been doing together with HealthNet TPO, this has been much more effective with a lot more of evidence-based interventions. Okay, and the last point is support for funding in proposal. If you've seen from the presentations made, this really helped the indicator bank really help in bringing up the proposal. And this aids organization in writing and evaluating funding proposals by including appropriate M&E indicators, which can strengthen the case for support. Okay. The Mental Health and Psychosocial Support Technical Working Group plan to use the developed indicator matrix to address the data gap identified in the National MHPSS Strategic Plan of 2025 to 2028. So thank you so much, Zena. I take it back to you.
Thank you so much, Felix and Zena. Zena, did you want to say any more before we move on?
No, just thank you so much, Felix. Nothing to add. And once again, thank you to the Interagency Standing Committee. Thank you to the MSP colleagues. You have provided us with the essential tools. Without the MSP, I don't think we would have gotten so much done in South Sudan. Thank you.
Thank you. It's so great to hear that. And it's so wonderful for us to see how when we release these global products, that's only the starting point, and then we learn so much about from how it's actually used in real life in the field. And so with the indicator bank, we released this PDF document, but the team in South Sudan then created these Excel tools, which made it much more practical. And now we can use these Excel tools, create hopefully a general version that we can share with other countries to be used in other responses. So the experience and the knowledge keeps growing. And it's just been wonderful to hear about from your experience. I also wanted to mention Leticia, who Felix mentioned. So Leticia is helping behind the scenes to answer some of our questions in the Q&A box, but she's also been a very essential member of this work, and she ran MSP workshops in South Sudan before this next step of the indicator bank. And just to say that the workshop materials for the MSP workshops are all available to download on the MSP website, and we can pop that in the chat. We're working on developing a module specifically on the indicator bank that will come with the next revision, but the main MSP materials are all there for anybody to use on the website. So with that, we'll move on to our last speaker. So we know that implementing monitoring and evaluation systems can be a little bit intimidating if you haven't done it before. But fortunately, we have the IASC Monitoring and Evaluation Helpdesk, which is a great source of guidance and support that's available to everybody. And we're really happy to have Brandon Gray, who's a technical officer at WHO, but he also helps to run the Helpdesk. So we're very happy to have Brandon here to tell us a bit about how they can support. So over to you, Brandon.
Thank you so much, Caoimhe, and thanks for inviting me for this webinar. I'm very happy to be here and hear about the amazing work that's happening and see this really important resource be advertised a bit, because I think it's such a key tool for filling a big gap that we have around guidance for MHPSS monitoring and evaluation. So yes, I'm representing the Monitoring and Evaluation Helpdesk of the Interagency Standing Committee Reference Group on MHPSS. And the Helpdesk is exactly what it sounds like. It's a place to go to ask for support all around monitoring and evaluation of MHPSS. And the reason is that, as exactly as Caoimhe had said, we feel this topic is very important, but it's often overlooked. And part of the reason for that can be that it can be a bit technical, it can be a bit challenging, it can be a bit overwhelming. So our help desk is here to support for those who have questions or concerns around M&E. Next slide, please. So what does this help desk actually do? Well, we're primarily focused around supporting agencies to use and implement the IASC MHPSS M&E tools that we've discussed today. So the common M&E framework for MHPSS, the MSP indicator bank, and it's really ranging in the forms of support we provide, all the way from giving basic information on how to use a specific assessment tool, for example, if it's in the Common M&E framework, to more complex support requests like developing M&E plans and implementing and then revising it and reshaping those plans over time. As Caoimhe had mentioned, our support is available to anyone, from a single local or international NGO to UN agencies to governments to MHPSS technical working groups making interagency requests. And we're really there, and I mean it, for supporting anyone who needs the support around MHPSS M&E. We're currently able to provide support in English, French, and Spanish. We're hoping to add Arabic soon and other languages as well in the future as is feasible. So to get in touch, it's pretty simple. You can email us at either of the emails here on the screen, and I'll also put these in the chat, or you can visit our webpage or complete our support request form that's there on the QR code. Next slide, please. Just a few quick examples of the types of support we've been trying to provide that I think are more related to interagency types of support. So we have offered a number of 3-day MHPSS M&E capacity building workshops for national officers or national technical working groups. And we also provide ongoing follow-up and support to the participants of those workshops. Throughout that process, we also try to engage with clusters and AORs around MHPSS reporting and the M&E process within the cluster system. Next slide, please. Another type of support that we've been doing a lot of is more individualized support for a specific agency, but it can also be for a technical working group. And it's something we call walkthrough analyses. So these are actually looking at an M&E system that already exists and trying to actually, as I say, walk through or follow data from the point of collection all the way to where it's stored and then analyzed and then actually used within the agency, ideally, or sometimes not used, to see where we can actually improve a system and provide recommendations for strengthening that. So these are a few types of support we provide, but if you're interested, please do get in touch. Next slide, please. And reach out to us on either the first email for English support requests, the second email for French or Spanish. Visit our webpage. It gives a lot more information about the types of support we can provide, some examples, and some other resources that are available. And it is available in English, French, and Spanish for the moment. Or you can simply complete our support request form at this QR code here. So do reach out if you have questions or concerns around M&E. We want you to know you're not alone in the process of trying to use the different MHPSS M&E tools or the MSP Indicator Bank. We're there for you to try to support in any way we can. So thank you so much. I will stop there. Back to you, Caoimhe.
Thanks so much, Brandon. And thank you to all our speakers. I think we've shared a lot of information. It's quite a lot to absorb, but hopefully it gives a good picture of all the different tools and support that are available to help people if they want to start start monitoring and evaluation for their MHPSS programs or to strengthen what's already there. So now we do have some time for questions and comments and reflections, or if anybody has experience implementing a strong M&E system in their context that they'd like to share. I'm sure everybody would love to hear some more examples. So feel free to raise your hand if you'd like to speak, or we can also take a look at the question and answers box. So I see most of the questions have been answered. Leticia and others are doing a great job of responding to them as they come in. There's one question there. Can MHPSS be implemented outside of humanitarian operations, for instance, in school curriculums? Would any of our speakers like to respond to that one?
Sorry, Caoimhe, I was in the midst of responding to another question, so I guess I'll just have to read it again. Just a moment. Can MHPSS be implemented outside of humanitarian operations, for instance, school curriculums? Yes, absolutely. We've been seeing a great growth, for example, of social and emotional learning programs in school curriculums and as additional activities not embedded in school curriculums as part of schools and other learning environments as a way of integrating MHPSS into schools as a way of enhancing children's mental health and psychosocial well-being, of preventing distress and mental health problems for at-risk children as well. And also it has been noticed that research shows that it's also a way of enhancing their learning. So that's one of the many ways in which MHPSS can be integrated and weaved into schools within or outside humanitarian settings. And that can also be achieved through structural group activities for children, not disregarding, of course, the role that caregivers also play and how they should be brought into these activities. And of course, if you are familiar, if the colleague that asked this question, and apologies for missing the name, is not familiar with the minimum service package, I'll remind you that although it is primarily directed at humanitarian emergencies, it has been also used in other contexts, protected crisis development settings, and it has been proved to be also very useful on those in those settings. So I would encourage you to go through it, maybe look into activities 3.5 on early childhood development, 3.6 on group activities for children, 3.7 on supporting caregivers as well, and that would all give you an idea of how MHPSS can be brought into school settings and other learning environments. Otherwise, we're also here to support in whichever way we can. I'm going to paste our email in the chat again. Over.
Thanks so much, Vania. We had a few questions asking about whether we'll be able to share the slides and also some of the tools that we shared. So yes, we're very happy to share them. I don't know, Joy, if we can put the slides on the landing page for this webinar. But certainly we can, if anyone wants to email us at this email that's shared on the screen right now, we can share the slides with anyone who's interested. We had a question about whether MHPSS, whether the monitoring tool is to be applied to all nations, or do countries have the option to make their own? Is it a uniform tool or does it depend? Would any of our speakers like to respond to that one? I can also have a go. So this is none of this is mandatory. It's designed to be helpful guidance. So it's there for people to use what they think will be useful that will help them with their programming. But it's not mandatory for anybody. It's just there as helpful guidance. So use it if you find it helpful, use the aspects you find helpful, but certainly things can be adapted to the local context. And feel free to jump in, any of our colleagues. I don't know, Brandon, if on the help desk you've had many requests that were around adapting tools for local culture and so on.
Yeah, thank you so much, Baby. Yes, so a lot of what we do is actually around adaptation because, of course, I think there are a lot of tools that exist, but they're not always applicable in the local context in terms of the words that are used or the language or the descriptions. And then there's a whole need to validate them as well in different contexts. So we spend a lot of time on that. And so if you're interested in that, that's something the help desk can support as well, is how to, the process at least you could take in adapting means of verification. Thank you.
Great, thank you. And that is a question we get quite a lot. So really great to know that the help desk can support with that. We also had a question asking about climate change. So does the Indicator Bank have a section on MHPSS and climate change? Well, the indicators in the Indicator Bank are related to the MSP activities, and those are relevant in any type of emergency, whether it's a climate-related emergency or a conflict or another form of natural disaster. So they can be used in any context, regardless of what type of emergency it is. I don't know if any of my other colleagues want to say any more about climate change. There's a lot of other work going on.
Take Brandon, because he's the co-chair of the climate working group. Anyway, Brandon, correct me. Maybe you want to say something to this point.
No. I was just going to say, I think we said it right. I think even for a climate-related emergency, we would still start with the minimum services package and then build from there, right? So the indicators that are in this bank are relevant for that, and I think they're relevant in a climate-related hazard or response or preparing for a climate-related hazard as well. There may be other things you would want to measure, but of course that's additional, and those are things you can of course do. The indicator banks there as a kind of a standard or starting point for the MSP. Thank you.
Fantastic. Thank you, Brandon, and great that we can draw on your different hats for some of these questions. So great to have that input as well. So we are just about coming up to the hour. So I'm going to wrap up there. And thanks again to Leticia for managing so many of the more questions in the Q&A box. I'd like to thank MHIN for hosting this webinar and all of the background work that goes into organizing it, especially to Joy, who's really been a great support for it. Thank you to our speakers. It's been so nice to have this range of experiences and expertise shared. Big thank you to our translators, Amani, Pascal, Paula, Daniela, Rebecca, and Camille. It's so important and helpful to us to be able to communicate in the different languages. Just to say, the Indicator Bank is also being translated into these different languages at the moment. So as soon as it's available in French, Spanish, and Arabic, it will be uploaded onto the MSP website as well. And finally, thank you to all our participants for joining. It's been really great to have your insightful questions and your participation. And don't forget, you can always reach out to the MSP help desk or the M&E help desk if you need help going forward. Thank you. Take care.